Welcome to Hope Talks. I am Dr. Charles Montorio Archer, the President and CEO at One Hope United. Hope Talks are a conversation between experts in our industry as well as thought leaders around issues pertaining to child protection, strengthening families, and stabilizing communities. Today's conversation on the intersection of community-based organizations will be held with David Ernesto Munar, President and CEO at Howard Brown Health. Welcome, David.
Thank you, Charles.
How are you today?
I'm doing great. I'm excited to join you for Hope Talks.
Well, thank you. This is our very first, and what better guest to talk about community-based organizations than yourself. Why don't you tell the audience and myself a little bit about what you do at Howard Brown and how you came to get to this position?
Great. Well, I'm President and CEO at Howard Brown Health. We're an organization that's almost 50 years old, founded to provide health and wellness services for Chicago's lesbian, gay, bisexual, transgender, and queer communities, so LGBT. But we're a full service community health center, and we serve patients regardless of their ability to pay through 12 clinics spanning all the way from Inglewood on the south side to Rogers Park on the north side. And even though we have expertise in sexual health, gender affirming care, LGBT health, HIV, we're a full service clinic and serving really the diversity of Chicago. And today we're providing medical care and other services for some 40,000 Chicagoans.
Wow, a lot of people actually. So tell me a little bit about why this mission is important in the healthcare space.
Yeah, Howard Brown was founded in response to the depth of discrimination that LGBT people experience in the world and particularly in healthcare settings. And even though there's been enormous progress in the last 50 years, culturally and legally to protect the rights and dignity of LGBT people, we still today hear of ample examples of individuals from our community who are not receiving the best medical care or receiving kind of the respect and dignity they deserve in healthcare settings. And these have real world consequences. You know, individuals who are not attending to their care, to their health, can see poorer outcomes, longer illness, and even a lower life expectancy. So our mission is really to serve our community and make sure that everyone in the LGBT community can receive high quality, appropriate, scientifically based medical care and wellness services. And then we're extending that network to anybody who needs affirming care in the communities where we serve. We also have an education program and advocacy program that works with other healthcare systems and other governments and other non-governmental organizations to expand their cultural competency working with the LGBT community.
With what you just mentioned around the LGBT community traditionally not receiving appropriate health services, why do you think that is the case, and what can be done to change it?
Yeah, I mean, unfortunately, in healthcare professions, there's not a lot of education about diversity, period. Mm-hmm. So in many cases, we encounter healthcare providers and workers who have never really thought about the special needs of the LGBT community and what those could be. They may not know a lot about our community, so they have a lot of questions. And then, I think they, for a lot of times, have not thought about what are the special healthcare needs of the LGBT community, and there are many. For our transgender patients, there's certainly cultural competency that's needed to make sure that our trans patients can feel safe and welcome and secure. Many of our trans patients need hormone replacement therapy or guidance around surgical options that are gender affirming. In sexual health, there's certainly sensitive topics for the LGBT community. Really, across the board. I mean, we have an alternative insemination program for our lesbian families that are trying to grow their families and they're not infertile, so they don't need fertility treatments. They just need a safe, affirming place to receive alternative insemination. So across the board, we're bringing awareness to other healthcare providers about those special needs, and also about the experience that can be very traumatizing when there isn't, cultural competency or support. And in some cases, there's outright discrimination against individuals from the community. And that's compounded by intersectional issues, right? So, LGBT people of color, or those who are low income or in certain geographic areas can face even greater barriers. So, for us, it's really about making sure that we can do what we can to serve our patients with dignity and respect and improve their health and lives. But then, as an organization, our mission is really advocacy, really trying to change the conditions for LGBT people and their families so that they can live full lives and reach their full potential.
I really definitely appreciate your work on so many levels. At One Hope, we primarily concentrate on children and youth. And with, younger people and children identifying as members of the LGBT plus community, Q plus community, are you finding more children coming into your centers and clinics for care, and how is that going?
Yeah, one of our flagship clinics is called the Broadway Youth Center, and it is a medical clinic for individuals 13 to 24. And we also have a deep bench of social services and deep bench of social services and kind of enabling care for young people who are experiencing homelessness. And many of the individuals who are housing insecure are LGBT, and being from the LGBT community has actually compounded their housing insecurity. They may have relatives, they may have parents or relatives that they can stay with, but their relationship may be very tenuous or stressful. They may have experienced homophobic discrimination or transphobic discrimination in the household or in their community. They may not feel welcome in some cases, or in some cases they've been put out. And we also see a fair number of young people that are in the foster care system, either currently or recently were in the system. Some have emancipated themselves, some are not finding the corridors of support that they need. And so that's magnifying some of their health needs and their kind of social determinant of health needs. So our work at the Broadway Youth Center is not just medical care. We provide walk-in STI services and walk-in primary care, but and also family planning, but also a deep bench of services for those who are homeless, including warm shower, laundry, and storage, group services, deep bench of case management to help people chart paths out of homelessness, as well as GED tutoring, vocational support, and then counseling and psychiatry, because there's so many, emotional and mental health wellness needs for the population. A lot of food that we provide through the program. So we're seeing about 3,000 young people that fit the category on an annual basis. Some of them we have contact with every week or multiple times a week, and some of them are episodic for a season. So it's really valuable work, and it's interesting that the homeless epidemic among youth is magnified and concentrated among youth who are LGBT. It says something about how poorly they're supported in schools and in homes. And parents also need, more support on how to deal with young people who may be struggling with their gender or their sexual identities.
The one thing is, when we think about this whole intersection of community-based organizations, including Howard Brown Health and all the other health-related, clinics, one thing that we're starting to really understand is that in order to serve an individual, you're basically servicing the family and this continuity or continuum of care, which is becoming very relevant. And I'm glad to see that some of the things that you're doing is really playing into supporting the individual beyond just their health needs, but also their living arrangement, education, et cetera. So my question becomes, what kind of partnerships do you find important in being able to service the multitude of needs of people that come into your doors?
Yeah, no, we rely on so many partnerships. So we're very grateful for One Hope United and many others who are helping extend the network of support. In many cases, we find that there are other services that we don't provide that we need to rely on our network for. Or we provide the service, but it's not geographically accessible where the patient needs it. So, having a network of housing and social service and behavioral health and advocacy organizations that are helping families, helping patients at any age group, that's really critical to the success. We have social workers that help our patients find the array of providers that are going to meet their needs, and it's tough. We can provide a bank of medical care and social services at our locations. Thankfully, we've expanded in the last several years, so we're more geographically accessible across the region, but there's still enormous gaps in terms of what we can provide. In many cases, people who need the help the most are in service deserts where there are not, entities in the neighborhood to help with a range of basic needs. We've seen that a lot with COVID, where we see people who are struggling because their transportation options are limited, income is tight or depleting, and that creates, housing insecurity, food insecurity, and a lot of depression and a lot of anxiety. So we're trying to do that as much as possible directly, but then obviously with our partners.
We've been seeing a lot, at One Hope where, you mentioned depressions or early stages of it, because of isolation and then health-related stuff. When you were dealing with or still currently dealing with COVID, how has it affected your workforce? How has it affected the participants and those who come in? And what do you think it's going to take to kind of break down some of these myths about vaccinations in marginalized communities or communities that traditionally, as you mentioned earlier, have not received proper health care throughout our communities?
Yeah, 2020 was really tough on our young people at the Broadway Youth Center. And the space is pretty small. It's about 5,000 square feet. And, we packed a lot into a small space, which was great pre-COVID. During COVID, we really had to remap how many individuals we could safely accommodate in the building. And so we converted the center into our medical hub for young people. But many of the social services we had to transfer out of the building. And we erected basically a wedding tent about a couple blocks away from the site, and are now providing many of the social services from that location. We've increased some of the kind of snacks that we provide and easy to prepare meals that we provide young people so that when we're not open, they can enjoy a meal and warm clothes. We're giving that away from the tent as well. And then for about 300 young people, we've equipped them with either smartphone or tablet so that they can have access to their mental health counselor and their case manager and their medical provider remotely without needing to rely solely on in-person visits. And the tablets especially have been great to continue GED tutoring so that individuals can get their high school diploma. But it's been tough. It's been tough on this population that, even pre-COVID, we're so vulnerable and so insecure, and many of them, their income to a person, their income is very limited. Some are, in the neighborhood, homeless. Some have places they can go, but it's a hostile place to go. So COVID's created more isolation, and it's been harder and harder to serve this population, but we're working hard to do that. In terms of the vaccine hesitation, I think the most important thing that we've been focusing on is to uh, really acknowledge that is a normal response to scientific misconduct. And we there's a history of misconduct in healthcare research that has um, resulted in things like Tuskegee and unethical research practices. It's resulted in forced and in some cases unknown sterilization of women in Puerto Rico. And so these things are real, and that history of, um, of abuse, is dogging us. And I think we need to recognize this. This vaccine was developed very quickly, and it's normal to question how was it developed, who was it developed for, and what might be some of the long-term effects. So I think starting there and really that hesitancy comes from a place of real experience. The communities have been harmed, and then trying to provide the information that we have. And so our medical providers, including our medical providers of color, have really studied the data, have talked to the scientists who help bring these vaccines to market, and they've taken them themselves. So we definitely want to provide accurate information, but also not discount people's normal reservations, and hoping that over time people will become more and more comfortable with the coronavirus vaccines.
I have a really serious appreciation for the word acknowledgement, because I think people forget that Tuskegee officially ended in 1972, to the fact that, this might be the first, vaccine that really, had, trial participants who were people of color, because I think people are acknowledging the sensitivity around this that marginalized communities have definitely faced over the years. One Hope United, services 93% of people of color. And inside of community-based organizations, particularly in your space of health, how has the community received your presence? How has the community received your willingness to support them in the places that they are?
Yeah, so over the last 6 years, we've really expanded geographically and now have 3 sites on the south side. We have northwest side site in Humboldt Park, which is predominantly a Puerto Rican community. For COVID testing, we're working with two partners, one in Little Village on the west side and one in Austin neighborhood on the west side. Those are Mexican American and African American communities. And our far north side, Rogers Park, is also really diverse. We've also been supporting testing with a mobile van that's gone to churches and homeless shelters and recovery homes and other congregate living sites on the west and south side. And really, we've been well received everywhere we've gone. I think last year in 2020, we provided COVID testing to 61,000 Chicagoans. And the vast majority of those, more than 50,000, were individuals who are not established Howard Brown patients. Oh, wow. And mainly individuals that probably have maybe are not LGBT and not really close to our mission, but they we were in a crisis. We are in a crisis, and Howard Brown has kind of a bench of experience responding to viral epidemics. And in our 30-year experience with fighting HIV, gave us a roadmap on how to make sure that we got the resources to the communities that needed it the most. And we really intentionally made testing low barrier, free, as well as collecting very little information and making sure that we could get as many people tested as possible. And so we're excited about that. I mean, I think in every community that we've gone, there's been an appreciation for what we're doing, gratitude. And I think, I have to believe that in some ways, the fact that we are there and creating access to these vital services during a pandemic is going to change the perception of some people who have had little or no interaction with an LGBT organization or LGBT people in the past. It's certainly not a prerequisite to receive services, but it doesn't take a lot of digging to figure out that Howard Brown is an LGBT-based organization. But our priority is really to change the outcomes of people in our communities. And LGBT people are in every one of the communities that we're at. And so it's important for us to go back to the communities of origin and make sure that they're taken care of.
I think when I think of, the Hope members at One Hope United and the members or your staff at Howard Brown, community-based organizations through this last year and in this pandemic has really held communities together. And, I've been really glad to watch all the work that you've been doing over at Howard Brown. But my last question to you today would be, well, what gives you hope? Because, there's a lot of conversations out there about the challenge of life. I would really like to hear from you, well, what gives you hope, not just in your personal life, but also in your professional life as well?
Yeah, I think, the vaccine is certainly one.
Mm-hmm.
I think our staff has been vaccinated, and right now we're working on vaccinating partner organizations. We started vaccinating patients 65 and older today. So, we're really and the staff that are administering the vaccine are sitting up a little taller, and they're really aware of the historic magnitude of the moment that we are, embarking and trying to get everyone in the country vaccinated so we can turn the tide on this pandemic. So that's one. But I think the other is really, our partners and the many creative ways that, those who care about the communities, care about our communities, are trying to make sure that patients and clients can be served, in whatever context, even during a pandemic, even during social isolation, and in the new restrictions that we've all become accustomed to. So that gives me hope. I think, that there are so many organizations like One Hope United and so many people that are, taking this opportunity to think critically about their delivery system and ways to do business, ways to have the same or better outcomes, through things like telehealth and more virtual, communication mediums or whatever it's going to take. We're doing so many creative things now that it's exciting. We're sending out HIV test kits to patients so they can safely test at home. We're doing telehealth visits. We have so many new creative approaches that we didn't have a year ago, and we're seeing that all over the sector. So I think, it is encouraging that organizations are leaning into the moment and making sure that people can get the help and support that they need.
So definitely thank you. I think it's leaning into the moment that I think we're all doing right now, which is very valuable. I thank you, David, for your perspective and your insight and being my first host or my first guest on Hope Talk. So thank you very much for being here with us.
Thank you for all the work that you and your team do for individuals in the foster care system and their families. It's really, really so important.
Well, thank you.
Congratulations.
For anyone else who would like to register for Hope Talks, please follow the link and follow us on all social media. We look forward to more of these conversations with people like David. Thank you very much for watching Hope Talks today.